Do you have a large body area and wonder if a transplant can really cover it? Well, today we're going to reveal how the skilled surgeons is going to tackle the large bald zones and making you youthful look and also making it a look natural. Having bald area can lead to kind of losing self-confidence. Well, what if I can tell you, we can restore the confidence and your youthfulness back with a planned transplantation. I am Dr. Sreedhar and I make videos to make you to understand about hair transplant surgeries and real results. Well, this patient is a class 7 baldness. We had planned a transplant surgery in 2 sessions, 6 months apart. Here we only targeted scalp grafts, approximately 7,850 grafts in 2 sessions. Well, here not only the number of the grafts that makes sense, it's also the correct plan and design which makes to get a maximum illusion and a benefit, a better camouflage. That's what we did it. Kindly watch the video until to end to understand what kind of results we achieved. When we handle class 6, class 7 large bald areas, usually is a tough job for surgeon because always it goes by the donor supply. Such patients has always a limited donor, and we also have a limitations per day because of the safe donor limit, not more than 4,000 grafts in a day. Either in such cases we need to plan 2 sessions 6 months apart, or probably we can do second day from the other source like a beard or chest. Well, this patient we stuck to only scalp and did 2 sessions 6 months apart. So here comes a tricky play, which was the surgeon kind of using a better illusion techniques and filling the priority areas can bring you the best results. Otherwise, you're going to lose all the grafts and you're left with certain area completely bald. So in this case, actually, we prioritize the frontal hairline area and mid scalp in first session to achieve minimum looks, minimum confident looks. Then rest of the area we are going to restore in second session in the crown area, and we also adding the density in the frontal area. These are the important things to be noted when we are planning such kind of large bald areas. So here, how do we conserve the grafts is most important. What are the right angles? Imagine when you are implanting in the crown area, right angles, like crown has a kind of a very acute angles and swirl will be there. All we need to follow to achieve the better natural look and even a better coverage. Otherwise, we end up in losing more grafts in here and there. So there is no reason to get very young and youthful look for this patient because we don't have that many grafts in the hand. So we need to be very careful while designing the hairline. Not only it should look natural and should also match his age. There's no point you're wasting all the grafts in the temple angles and on the forehead because any given patient class 6, class 7 baldness has limited donor supply. In such scenarios, having class 6 and class 7 baldness, we need to prioritize our plans. Usually, we need to divide into 3 parts. Number 1 is front and mid scalp. Number 2, crown. A third one would be a final look. So usually in the first time, we're going to give dense packing and more priority to front and mid scalp because that is the most visible area for anyone. So once we cover that area, you're going to restore the confidence back. Next one is we're going to implant the crown. Crown actually is a separate technique when compared to the frontal area because crown has at times single swirl, sometimes double. And also we're going to give you a little less density in the crown so that it should match to the dense area of the mid scalp. Otherwise, you have more kind of hair in the one area, another area you don't have the much density. So it has to blend with from front and mid scalp to crown so that we're going to give you a little density and the right angulations in the crown to achieve naturalness. When it comes to the final look, maybe after 6 months later, minimum gap, or could be later anytime, we're going to implant more grafts in the crown again and more grafts in the front mid scalp to achieve the best density. So that's how we're going to achieve the final look. Well, this patient we did only two sessions. First session was front and mid scalp. Second session crown and again implanting some density in the front and mid scalp. So with that we achieved a beautiful camouflage, nice illusion that he has got good density. Well, here we should never expect a very youthful hairline in such cases because we always have a limited donor supply. So we always keep in mind our donor and a demand matching ratio. Otherwise, if the donor supply doesn't match to the demand, then we end up in having a disastrous outcome. So here, I really want to remind you not only the number of the graft that makes the transplantation successful, how wisely we are going to use it, what manner, and what angulations. All this really makes definitely a natural look and fullness in the scalp, so such a way that it matches to patient age and needs. Usually, class 6 and class 7 baldness patients, we usually think that number of the grafts can bring you the results. I've seen most of the patients would tell I had 6,000 grafts covered everywhere, but I didn't get density. Some posts in the on the social media, I would see 6,000 grafts are implanted. They show a dense packing of implantation done immediate post-op. That makes patients so happy. But kindly remember, the number of the grafts would not bring you a natural results for you. More the number doesn't bring you natural results for you. It's all kind of a illusion that we are going to create art and technique that plays a crucial role in a transplantation to achieve best results. Imagine if you're implanting in a straight angle in the crown, if we don't get any density. So each and every area on the scalp has a different angulations. Hairline has a different angulation, mid scalp has a different angulation, crown has multiple angulations. Different angles we have in the crown. Same person can have this many angles. The same crown backside bends towards back, so it's going to be a different angle. So combination of all this definitely goes by with best art and technique than graph number alone can get you your best outcome. It should be especially natural looking. Otherwise, it doesn't make any sense. So most of the transplantation, you can just identify at half a mile distance that transplantation has been done. That's not a good transplant. Unless you examine it, no one should understand that transplantation is done. So even if someone is sitting in front of you 2 feet away, no one should know that you have done a transplantation. That's the beauty of the transplantation. Kindly remember, such kind of cases, do not expect very younger look. Because of that, you're going to waste a lot of grafts on the hairline. You don't get nice coverage in the mid scalp. So you have to get a natural look than a very younger look, which is going to match not only current needs, future needs for you. You're going to grow with age, you're going to be 30, tomorrow 40, then it should match to your needs and age. Still, it should look natural. That's the beauty and the concept of the transplantation. That's what people say. It's not only having kind of hair on the scalp, it should, that such a kind, having no attention to it. Just having hair doesn't make any sense. Having no attention to it is most important in a hair transplantation procedure. So yes, you can have a large bald spot. A transplant can provide you a natural look and life-altering results for you, provided with a proper plan and expectations. Proper plan can be designed by a best skilled surgeon. So kindly go with the best surgeons to get your transplantation successful and have a life-altering results, which is going to make more confident.